So the way this works, Debbie, is this is our Housing and Human Services Advisory Board. Agencies will have basically 15 minutes for a Q&A time. Karen Roney, our director, will keep us on track with that. And more than anything, it'll really be, we'll start with questions. We'll questions from the board around your application. And then if there is time at the end of those 50 minutes, you can share something. Does that sound okay?
Sounds good.
All right. So Karen will tell us when the time starts, and then we can start with our Q&A time.
Okay, I'm pushing the button now.
Hi, Karen. Thank you.
All right. Does anybody have any questions, or I can go first if
Graham.
Graham has a question. All right, go for it, Graham.
Yeah. Hi, Debbie.
Hi, Graham.
I see that you gather information from your participants and measure its effectiveness for improvements of their lives. I'm curious how you use the feedback to improve the program itself, though.
We've been, well, part of the mental health series that we want to implement is based on the feedback that we've gotten from group participants. And programs that haven't been effective, we would drop. We haven't had to drop anything yet. We've gotten really high numbers in terms of self-reporting positive outcomes. So, but it's, you know, being a startup, we want to make sure that we're plugged into what the wishes of our constituents are. And so that's how we use the feedback.
Cool. And could you briefly?
I want to apologize for the grant application. I'm really new at this, and you guys probably got some laughs out of it. And I just finished my grant writing class at Front Range yesterday and was just cringing when I was looking at this application again. So please forgive me.
Oh, it's not easy. We understand. My last question is if you could briefly describe what the acceptance and commitment therapy model is.
It depends on the program. The group support programs like Red Road and Life Ring, they're basically 12-step programs. Those we don't require any commitment from. We do have volunteers facilitating them who have previously been participants in the group. They're facilitating them now. The commitment for the IOP, we have people sign a contract at the beginning that they will commit to attending 80% of the sessions. And it's been, the attendance rate has been much higher than that. So people, when they come in, they're really committed. There are no mandatory participants, mandated participants. Everybody comes to us on a volunteer basis. Does that answer the question?
I think so.
Okay.
Thank you.
Other questions from the board? I have one, Debbie. I'm Caitlin Abbott. One of the items that you noted in the grant application is a projected shortfall of about $29,000 for a year, along with some a narrative about volunteer folks were willing to work on a volunteer basis. I wonder if you could tell us a little bit more about anything you're doing to address that shortfall, aside from, you know, some folks working on volunteer basis and then the landlord agreeing to waive rent.
Yeah, we have right now 15,000 grant dollars, 15,000 in the pipeline. And then the other thing I addressed is that we've really gone slow on fundraising because we've been struggling with the website. We were trying to do that in-house, and that didn't produce satisfactory results. And so we've contracted that out, and we're about 2 weeks behind schedule. I was hoping to roll that out October 1st. and that will be coming out the second week of October. There's also been, I think that we've been weak in social media. And so the person who's responsible for that, he will be taking a front range class, social media and business. That'll start the middle of October, finish the end of November. So I expect our online presence to be much stronger. And once that's in place, then we're really hitting the bricks in terms of fundraising, local small businesses, private donors, which we've just had on hold right now because it's my strong belief that you never get a second chance to make a first impression.
Great, thank you. Eliberto.
Thank you, Caitlin. So Debbie, when I read your application, I saw the MOU with the in-between, and you mentioned some of the other providers. I'd love to learn a little bit more about how you work with those other providers, for example, Recovery Cafe or Mental Health Partners, those other folks that also address this issue. Is there monthly gathering? Is there any type of conversation, collaboration piece going on, or coordination, I guess is a question too?
No, there really hasn't been. We've met with the Recovery Cafe a couple times. We've been in touch with them. We've had some common clients going back and forth. They're definitely on the list to talk to them some more. I'd like to get in touch with Lisa and just compare notes about what we're doing. We're sort of in a different position than Recovery Cafe in terms of what they're doing, because we go, we're about community, but we go a lot deeper in our services with our structured recovery programs using the Hazelden material. Hazelden is the premier recovery center in the United States. They're the gold standard. They're known throughout the world, actually. Mental Health Partners, the independent contractor that we work with right now to provide licensed counseling services, he works at Mental Health Partners. So we've got a connection there, and we've got one new volunteer from Mental Health Partners. She is not leaving her job there, but she's really excited about what we're doing, and she wants to work with us on a volunteer basis, which I'm really excited about. We've referred some people to Mental Health Partners who need to go deeper on the mental health support in terms of actual doctor support for prescriptions, or have mental health conditions that are out of our league. We did just start, we had a conversation with Alice from Hope last week, and we'll start working with them this week. Once a week, we're going to go to their shelter at the Journey Church to talk to people there, and then start getting clients from the homeless population. Does that answer your question?
Yeah, thank you.
Other questions from the board for Debbie? Karen.
Thanks. So Debbie, it looks like when I looked at the org chart, it looks like that the staff members that you have working at A Way Forward are also the board members. So, so can you clarify the differentiation of roles? I mean, it seems like you're pretty much a startup agency, and you're really struggling to get. I mean, you're still in the very preliminary stages of getting your agency up and operational. So, but it looks like your staff members that that your board basically serves several staff member roles. They're kind of one and the same. So can you clarify that?
Yeah, so all of us are very much involved in the organization. We only have two staff, if you will, now, two people that are getting paid. The rest, it's on a volunteer basis. The board contributes to the organization by also facilitating groups. We trained 10 people to be certified recovery coaches, which is also a distinctive competence for us providing these services in the community. Two of the people that we trained are board members to be certified recovery coaches. And so the board members are very much involved, both in terms of getting donors in the community, increasing awareness of the organization, but also hands-on in the organization, facilitating groups. One of the directors, Larry Rand, he's got 33 years of veterans outreach experience, which coincides with his number of years in sobriety. And so he's very experienced with facilitating groups and especially speaking to veterans. And then the other board members are also each facilitating one class currently.
So Caitlin, can I continue
Yes,
with a
go
couple
ahead,
other
Karen.
questions? So the you indicate, hang on here, that you indicate in the application that you plan to serve 110 Longmont residents in 2022. But it looks like elsewhere, you know, that when you look at your information, that in terms of your program information, that number is more like 24 participants. So can you talk about the difference between the 24 participants that would go through the program and 110 that are being served? projected to
Yeah,
serve?
sure, Karen. I might have misunderstood that. I read that to be unique contacts. So overall for the organization, we're predicting 110 unique contacts, which is very conservative because already in the first 8 months, we've had 139 unique contacts out of a total of over 1,500 total contacts.
So what's a
So-
unique contact compared to the 24 unique participants that would go through your 2 rounds of 6 weeks?
So the
education?
24 unique contacts would be in the mental health programs exclusively in this project. So this project consists of 6 modules in the mental health program, addressing anger, anxiety, depression, grief, self-esteem, and shame and guilt. And so each module would, in the first 6 months, would have 2 new participants that haven't participated in anything else at A Way Forward. And the 6 modules are repeated in the second half of the year. So the 24 unique contacts would be exclusively for this project that we're applying for funds for. The 110 are just in general in our organization. I anticipate that number to actually be much higher if I'm looking at the numbers that we've already achieved in 2021 of 139 unique contacts. So people who have come in for the first time and then stayed. And like I said, the total contacts are over 1,500 so far in the first 8 months.
Debbie, just to build on that, is my understanding correct that that because of your relationship with the in-between and then the work you're doing with the other organizations, you're doing sort of less intense, but still providing services to folks. And that's where that difference between the 24 and the 110 is coming from, is more, sort of like one time or group sessions, whereas the program you're applying for is for individual going through these very specific modules over the 6-month period.
No, those wouldn't be individual participants. Those would be groups.
Okay.
But out of those groups, and I anticipate, some of it is contingent upon any kind of COVID restrictions that might come down the road. But the groups generally have 6 to 8 participants. So that's what I'm envisioning for each module, each mental health module. And then out of those 8 participants, 2 would be new to A Way Forward.
And Beulah the buzzer has just gone off.
Uh-oh.
That means we are at time. So if there was anything else that you wanted to share with us before we break.
I'm really excited about where we've been going. Erica Zempa has been giving us a lot of support. I call him anytime I have a question. He's totally got our back. He really believes in what we've been doing. He's been involved with us since we first started. I think that we really fill a gap in community services. I hope that that was apparent in the story that I included at the beginning of my grant application. We've had quite a few people like that need services immediately, need more than just AA recovery groups, that want to go deeper into their recovery. And been really pleased with that. We have a boy right now who's been coming to us for about 6 weeks. His mother brought him in. He's a student at Old Columbine, and he is just doing so great in the program. And he started bringing his girlfriend, who also has substance use issues. And, it's a gap that nobody else is filling in the community. Recovery Cafe is wonderful what they're doing. Mental Health Partners is wonderful, but there has to be something in between that provides that seamless social safety net where people can just walk in the door 7 days a week. We're available anytime somebody wants to come in and talk to somebody about services, and then we can get them into one of our structured programs and really give them a strong foundation for the support. All of us are from Longmont or Boulder County. We understand the community. It's really a community recovery center for the community, by the community.
Hey, that is definitely time.
Okay.
Thank you so much, Debbie.
Okay, well, thank you so much, and good luck tonight. You've got a long evening ahead of you.
All right, good night.
Okay, bye-bye. Thank you.
All right, up next is BCAP. I'm gonna let them in now. So, Frank. Hey, Frank, how are you?
Hi, I'm well. How are you, Alberto?
Doing well, doing well. Hello, Sarah. So just Frank, you've done this before. You're an old pro. 15 minutes is what you will both have of primarily question and answers. If there is time at the end, we'll let you share. Caitlin will be leading the effort. She is our board chair. So Karen is our timekeeper. She will give us the signal to go, and then we will start with our questions.
Sounds
Go.
good.
All right.
All right. Any questions from the board to kick us off? Deanna.
Hi, thanks for being here tonight. I just wanted to start off with, this is my second year doing interviews on the board, and I was looking over my notes from last year's, and we had talked a little bit about funding sources and diversification last year. I thought maybe you could just talk about what your efforts have been and what that looks like.
Certainly, excuse me, certainly. So gosh, last year, it's interesting. There was actually quite a bit of diversification in funding offered through COVID-19 response. And so last year, what was particularly helpful for BCAP and Boulder County AIDS Project was to follow those opportunities and put our applications out there for the emergency relief funding through state government, through local government resources, foundations in collaborations like through the governor's funds in collaboration with Mile High United Way, and donor response, by opting to not have an event, fundraising event kind of per our operational COVID-19 protocols and considerations, reaching out to donors and getting a really set of invested responses. So I think that's kind of what took place specific to to last year. We also pursued, in collaboration with Boulder County Public Health, another state grant opportunity through the CHAP program, Colorado HIV and AIDS Prevention Program. And through that funding source, which we've received funding from in the past and then got reinvested in again, starting as of July 1 of this year, we were able to expand our prevention programs to include comprehensive PrEP, pre-exposure prophylaxis services, which is a biomedical intervention that people at high risk of HIV acquisition can get on an HIV medication and take that daily, and then avoid actual acquisition of HIV if they encounter it. So we're expanding those programs and services in collaboration with the county. And then also in terms of our services to people who use and inject drugs, to be able to, in collaboration with the county, add on another team member who can focus more on the case management aspect with people who use and inject drugs, really helping to kind of help prepare people for the referrals that they're receiving and the syringe access kind of programming and street outreach programming. And Sarah, if there's anything you'd like to add, please feel welcome.
Yeah, I was going to speak to the donors as well. They really did step up in a big way, the ones who were able to. I feel like some people couldn't give any more and they, but other people really pitched in above and beyond, knowing it was 2020.
Frank and Sarah, I have a question. One of the things that I noted in your application was that some of the testing had been suspended with COVID. I'm curious if you could talk a little bit about the impact of that on your programs and sort of what, it looked like you've got a plan sort of for 2 years out, end of 2024, to reach those pre-COVID testing levels. I'm curious your perception of the impact of that on people living with HIV and AIDS in the community, or, that reduction in testing, how that impacts your programs.
Gosh, what an impact that actually has had. I think one of the biggest impacts, and one of the successes we've had in counseling, testing, and referrals as a service to the county and within the city of Longmont is building up that program over time in collaboration with community partners. And so the investment to bring the service to those spaces and do that direct outreach with the people accessing the services at like the Longmont Community Treatment Center, at El Comité de Longmont. So really being able to reach populations that are needing more support and needing more outreach in the service, brought to the spaces that's where they're accessing services and or with folks they trust, right? And building the trust with BCAT. So and COVID has interrupted that. So, that does have a huge impact. And I think that's an impact that a lot of entities, including medical homes, right, offering services, there's just been these lapses in care throughout COVID. In part because of restrictions, in part because folks are experiencing isolation, in parts because organizations are trying to open up services within the organization and do it as safely as possible. So what we were able to do was invest in at-home tests where folks who were needing to access the service we could connect remotely. If they're wanting to get tested, we could do the pre and post test counseling virtually. And then they could swing by. In Boulder, we have a service window. So that's right at the front of the building. And so what that allowed is for folks to pick up the at-home test and self-administer. And then for those who are comfortable, we could get the blood sample through the window. So although, we weren't able to do the same type of outreach in the community and more spread out throughout the community with community partners, we did invest in at-home testing and really worked creative to open up the service window and basically maintain that service throughout COVID. And to kind of reference how challenging that is, Boulder County Public Health didn't offer their testing services throughout COVID. They just resumed in August of this year. So hugely challenge to make that happen, but we did the best we could and put out the word as much as we could, and but as soon as it's safe with COVID protocols that match between us and any organization, we're starting the conversation again with our management team, looking at how to resume. We think it's just going to take some time to integrate back into those the services with the community partners in ways where our COVID operational plan are aligning, because for people living with HIV, even those who are vaccinated, those who have crossover cases, they're still like 30% more vulnerable to COVID. And so for the populations we serve, we have to be really conservative and intentional and model the safety protocols that we are hoping they choose. Because for those who do acquire COVID, the body responses are even more serious than the general population, and in some cases more general than people who are experiencing other health issues as well. And a lot of the folks we provide services to are experiencing comorbidities, so they are managing multiple health issues, and a good percentage are aging, so they're also more vulnerable from that point of view. So a bit of talking points to speak to your question. Thanks for asking that.
Yeah. Other questions from folks on the board? Okay. Oh, Eliberto. I figured you might have something in there.
I do, and it's gonna get a little weedy, so I apologize up front, and only because Frank, I'm a big logic model guy, and so when I was going through your logic model, I said, okay, I get this, and I have a question about it. So in your first activity, I think it's your first activity, you talk about the people who are living with HIV case management. And one of your outcomes, I think is a great outcome. And I just want to know a little more about how this happens. One of your outcomes is that your case management will lead to undetectable HIV virus or an undetectable HIV viral load. And I just want to learn more about how does that happen with your case management? Is, what are the things that go on that help get us there?
Certainly, I can speak to that. I know Sarah can speak to that equally well, and want to give her an opportunity to talk as well. Sarah, would you like to speak to that, or do you want me to address it?
Yeah, So great question. And thanks for asking that. I would say that, you know, the importance of connecting the people that we're serving who are living with HIV through case management to medical care and treatment is really, it can't be overestimated, because that is getting people in care with HIV providers who are specialists and really know how to address HIV in the best way for each individual that they're seeing is what's going to help bring their viral load down, to get them the right medication that works best for the person. And that can really vary too, depending on how long someone's lived with HIV. They might be resistant to some of the medications, et cetera. So that really needs to be figured out. And case management. And so once they're on treatment that works for them, their viral load can become undetectable, which technically is less than 200 copies of the virus in a milliliter, cubic milliliter drop of blood. And so, and what that can mean for the individual is improved health, increased longevity, as far as their lifespan, as well as a reduction in sexual transmission of HIV. You can't really essentially can't transmit HIV if your viral load is maintaining at an undetectable viral load. It's an incredible, you know, advance. And so the focus of case management really is to get people in treatment. And so the support that we're offering with the financial assistance, which is part of our grant request to the city of Longmont, some of that financial assistance to help people not have to focus on, you know, do I have the money for the rent or the utility bill, or, you know, getting to the doctor. Helping with that kind of support and addressing those inequities is helpful in keeping people in their healthcare. Did that answer the question?
Yeah, I mean, I figured there had to be some medical connection, but you know, from the outcome statement, I wasn't sure. So that's why I wanted to delve a little deeper. Like, so how does that happen? And so really what I'm hearing is that the case manager ensures that their participant or client or whatever is engaged and connecting with their medical provider.
Exactly. Yeah. And then we even have these pretty regular based medical consultations between the case management staff and their providers of clients, and where they sort of troubleshoot sometimes on how to re-engage someone in care, or whatever the challenge is or the successes. They meet about all of those and consult on the different client situations.
And if one thing I'd like to add is just, you know, with really robust case management services, particularly in a county that does have a really strong regional provider network that works well together and collaboratively, you know, we can produce this type of outcome that benefits the community and minimizes HIV transmission in the community, which is a really big goal. And it's a way that accomplishes both improving health outcome for individuals and the health of the community. Nationwide, it's estimated that about like 55 to 60% of people living with HIV have an undetectable viral load. So that just goes to show that in case management, with those services being provided at the right capacities, that we can do better, you know. And the statewide goal is slightly higher, but still slightly higher than the national average, but quite lower than like if we just really look at the people living with HIV who are in case management.
Great. I think we're probably right about at time. Karen, I haven't heard, but you're muted, so.
Beulah hasn't gone off yet, but she's about to. But I did have a question. So do you have reserves? I know you have a 3-month operating reserves. What do you have in terms of capital reserves? Because you do have a building or a property that you own. There's Beulah, a property that you own. Is that correct?
Yeah, there's a group level residents for
Right.
people living with HIV that can house up to 4 individuals.
So how
at
do you
any given
plan
time.
for capital maintenance for that facility?
So a combination of a conversation with, as we're writing the budget, a conversation with the board, determining if they're going to designate funds for any capital improvements. With enough notice, that's one of the best outreach to donors, that type of support. So the past few years, we did donor outreach, secured the funds that were needed for capital improvements, and then had the funds to pay for them. So like things like radon testing and getting that, updated.
Yeah, we just replaced the roof too,
Mhm.
and we paid for that in full.
So it's mostly through donor outreach and specifically fundraising for the capital improvements that you need.
Mhm.
Mhm. Yeah, and we have some donors that date back quite a long time with VCAP who are specifically connected to the house and interested in always checking in about how the house is doing. I mean, they're helpful to, if we had to kick off something really big, that would be the person to write, the appeal with, and they've offered that.
Okay, great. So Caitlin, that is
time.
that is time.
Thanks, Frank and Sarah. Really appreciate you being here tonight.
Yeah, thank you all very, very much. Take care.
Yes, take care. Bye-bye.
Bye.
So our next group is senior housing options. And they're a new group as well. Jim Goddard, their CEO, is in the waiting room. I'm gonna go ahead and let him in.
Well, so we can, is there anything that we need to do differently? Is the process going okay? Any suggested changes? Just checking. We're
All right.
early. All right.
We're doing well on time. That's good. All right. I'm gonna go ahead and let him in. Jim, you should be able to unmute yourself. My name's Eliberto Mendoza. I am the project coordinator for community services. You can see our names on our screens. So just a real quick rundown of how this is going to go. You have 15 minutes, primarily of question and answer. If there is time at the end of the 15-minute Q&A, we will let you share whatever you'd like to share. Karen Roney, who is our director, is also going to be our timekeeper. So she will buzz you when time is up. And she'll also let us know when we can begin. Caitlin is our board chair, and she will run this process.
Thank you. I believe we have a couple of other people who are joining us today too.
Is it Ann Taylor Modler?
Yes.
And Tamar Berner?
Yes.
Okay, they are here. I'm going to go ahead and admit them.
I believe Kathy Pugh might also be on.
I don't see her in the waiting room.
Okay. So actually, Tamar and Ann will probably field most of the questions, but I'll be glad to chime in as well. I'll let them take the lead.
Okay. So Karen will let us know.
Tamar and Ann, just a quick overview. I'm Caitlin, the board chair. Karen's going to be our timekeeper. We've got 15 minutes, so we'll spend most of the time on Q&A. If there's any time at the end, we'll give you all an opportunity to share anything else that you might want us to know. But we'll go ahead and get started with questions, if you all are. Oh, and Graham is ready to go. All right.
Thanks.
Thanks.
Thanks, Caitlin. Hey, Jim and Tamar and Ann. I see in your logic model in indicators and outcomes, you use the phrase positive overall wellness benefits. And it feels like that's doing a lot of work. And I'm just hoping you guys and gals could fill that out for me and give a little more specifics as to what does that mean.
Anne, do you want to address that?
Sure. Yes, the overall wellness benefits are, first of all, hello to all of you. And I'm off camera because I'm traveling. So just a quick excuse on that. Yes, the wellness benefits are very mental health based in their concrete development and have to do with all of the different kinds of things that we provide for the residents, from physical, social, supporting their medical health, and then their mental health. Would you like me to be more specific, or is there a follow-up question that can go with that?
So they self-report on how those metrics are doing?
There are a number of ways that the reporting comes in, definitely with the folks, the staff, the program staff, both partners who provide those actual activities, which would be the yoga instructors and some of those folks, also looking at participation numbers, so how many folks are in the room. And there are regular surveys and resident-led councils. I'm kind of giving you a broad stroke overview, but there are also resident-led councils that also feed into that input. So it is from a variety of places.
Okay, thank you.
Sure.
I might also add that as an organization, we've developed what we call a Show Me the Power of Wellness. It's sort of a wellness model that integrates a number of different aspects. And we're trying to offer programs in each of the different elements of intellectual dimensions, social, physical, emotional, spiritual, occupational, environmental health. So our goal is to be sure that we try to address all of those.
Karen.
Thank you, Caitlin. So I was curious in your, I guess I need to better understand your operating budget. So you talked about, and maybe it's the overview of the financing of Cinnamon Park, because you included management fees as revenues, but you really didn't include all of the rental income that that comes in. So it just wasn't a very detailed operating budget, just said salaries and management expenses, but I also didn't see any reference to your rental income until I went into the audit. So maybe a quick overview about how Cinnamon Park is funded.
I'd be glad to take that. And then I'm going to refer to Kathy Pugh, who's also online here, who's our controller. But think of it as Cinnamon Park and the apartments at Cinnamon Park as separate entities from senior housing options. They're sort of owned entities. Each of them has rental income and or subsidies from either Medicaid or from HUD. Right. So as an entity, as an individual entity, they get rental income, and then management fees are a certain percentage of that income that goes to the senior housing option ownership. Does that make sense?
Yeah. So is Cinnamon Park primarily housing for low income older adults? So do you get is it heavily subsidized with HUD Section 8? So I'm just interested in the funding for
well, there's
Cinnamon
actually
Park.
Two different Cinnamon Park entities. One of them exists right now, which is our assisted living.
Right.
And so that is subsidized by Medicaid income. And the vast majority of our individuals qualify for Medicaid, of our residents. The new entity, which is a 25-unit apartment building, will be it's subsidized through CHAFA using low-income housing tax credits. And so, yeah, it's sort of a Section 8 property that will serve 30% AMI, 40%, and up to 60%. I hope that answers your question.
Yeah, it does. It does. So I'm curious how I'm not sure what the funding will actually provide. So you asked for 20,000. I see some was for a technology upgrade, but that's $10,000. I'm assuming that's a one-time expense. And then there was, that would leave $10,000 for expanding activities, the activity coordinator. So please help me understand what $10,000 to support the activity coordinator would really do.
So the activities coordinator currently works 30 hours a week for our assisted living community. So the thought is it would expand that position to full time, and then they would also be able to work with our 25 new tenants that will be in our subsidized housing.
And the subsidized housing doesn't come online until when?
Spring 2022.
And so and this is my last question, Caitlin, sorry. So how did you consider this as part of the overall kind of rental fees and charges and, for your tax credit budget? So, because it would seem like some of these things should be things that you're able to incorporate into your budget in terms of your financing for your project, because it's operation. And so I'm just curious about that.
Typically, a housing project and a LIHTC project like this won't necessarily include services like activities. The advantage of having this new building on the same site as our assisted living is that we can share a lot of services. We are receiving sort of a seed grant from Healthy Housing, which is a Colorado Health Foundation grant through CHAFA that will kind of give us some of the materials necessary for those activities and some support for our overall coordination of activities. And so this would help subsidize and make that a richer offering. Did I get that right, Tamara? Is there more to that?
Yeah, it would also allow us to partner with community services as well. So it would allow us to have some money to be able to partner with them. So other nonprofits and community agencies that can facilitate activities for our residents and tenants.
And that would include benefits in action. Mm-hmm. Is that correct? Yeah.
Deanna, I saw a hand there.
Yeah, I just had a question about how you find your residents or how they find you. And let me tell you specifically why I'm asking this question. When I looked at your application and noting who the proposed clients were that the program would potentially serve, I noted that there's no African-American individuals listed and the vast majority of people are Caucasian. So I'm just curious about diversification of residents and why you think that is, or how they come to you. I'm not sure that I'm articulating this very well, but maybe you get what I'm wondering.
I mean, I can take that. So a lot of our folks come through word of mouth, and we've been around for quite a while, the Cinnamon Park Assisted Living. And I think it's just, the demographic of Boulder County and those we serve, I think primarily right now has been Caucasian, and we definitely hope to diversify. But that's just been who has come to us and who has needed our services at the time. That may change. We've never delved into subsidized housing in Boulder County before, so I would imagine we might see a slightly different demographic. But we get, primarily, I think, for Boulder County, I do a lot of the marketing. It's working with Boulder County Housing Authority, working with the city of Longmont as well in different areas to get referrals. And that's primarily how we have folks come to us.
Do you keep a wait list for your housing right now? For your assisted living?
So we currently, we have not been full at Cinnamon Park Assisted Living, partly due to COVID. But we actually are about to be full, which is great. But yes, historically we have had a wait list.
Madeline. You're muted.
Sorry about that.
There you go.
Hi. Hello, everybody. I am, you said your outreach, I'm curious as to, in terms of marketing and making known what services you provide and what services are available, particularly to the African American community within Longmont. What are your efforts? Exactly what have you done? I know word of mouth is probably the best marketing method. But for something given this day and time and based on the need, what specific efforts have you considered or are you considering for the future? Because the need is definitely there.
Yeah, I mean, we're trying to expand every day and I'm always open to suggestions. So, you know, we've been marketing to a lot of senior organizations mainly. So a lot of hospitals and care communities and rehabilitation centers. And that's really the route that we've taken. We belong to Seniors Blue Book and things like that. We've done ads in the newspaper. We've talked about doing some radio ads. So any way that we can access folks, we're definitely different homeless agencies we've been talking to. It kind of runs, the gamut as far as who we've reached out to, but we're always open to expanding that and, thinking of ways that we can get the word out there about us and our services more.
One of the key areas that I should mention is the Housing Authority. They keep a wait list and they have already agreed to share that with us so that we can basically market to that group. The other senior low-income housing entities, our understanding is all have wait lists as well. And so as much as we can try to coordinate with them, we will. Longmont Senior Services is also a group that we use a lot for our activities, and they're a good, I think, a good way to get the word out. Again, most of our effort in the past has been to try to find those who are interested in assisted living. So we're kind of treading new ground with the concept of marketing for affordable housing in Boulder County.
Mm-hmm. Okay. I would just in case you don't know, we do have Boulder County branch NAACP that's now in its 4th year with about 850 members strong that can help you get the word out. So if you'd like to connect with them, I can certainly give you contact information, particularly for that particular element and that component being low-income housing and the needs that are very prevalent.
Thank you.
Mm-hmm.
If I could just make one quick comment to follow up. I know we have a lot, each of us, on our mind, and one of the things that Jim has shared with me and the team in the past is that we are also always looking for staff, board, volunteers who can give that community voice and engage us in a different way. So yes, this conversation right now is specifically to Longmont, but it is a learning time for the organization to think about how some of those partnerships can continue to evolve in order to be more inclusive. So it is something that the board has prioritized, and policies and procedures are already in the in process there, because it is something that we absolutely know we need to do. And Madeline, I really appreciate you bringing that up, and also would take any advice and information that you might share, because I think even though senior housing options have been around for 40 years, feels very young in the space of this. It's kind of an ongoing conversation with other funders and other partners as well.
Mhm.
Thank you. And it reminds me also that we are in need of staff as well. And so as we communicate and connect with these entities, we'd like to be sure to inform them of the opportunities within our industry. By the way, our staff is really quite diverse, and much more diverse than our resident population. We've made a lot of strides there, and if you visit our website, you'll see some of those results.
Okay. I'll do
All right,
that.
so I don't know if you heard, but Beulah the buzzard went off, so we are past our 15 minutes. So, Caitlin.
All right. I think, thank you all for being here, and we appreciate your time tonight.
Thank you very much.
Thank you.
Thank you.
Thanks, everybody.
Goodbye.
Appreciate your time.
Madeline, are you able to hit the option to unraise your hand?
I am. I'm so sorry.
Oh, no, you're fine. You're fine. That way I just don't get confused on the next one. And I'm like, Madeline has a question. Oh, wait, maybe she doesn't. I was going to say, somebody said that their staff was a lot more diverse. I was looking at that and I was like, that's way more diverse than the staff for almost any organization that we've seen here.
Oh, I got to look at that. I haven't seen it.
I think part of that's because I think their main area of service is Denver. So you'll get much more diversity in a bigger city in like Denver.
Right.
Got it.
Yeah, but that's part of why they're so diverse, because I think their primary area of service is Denver. And like they said, they are newer. In Cinnamon Park's been around for a long time, but you know.
Yeah. Well, this being my last term, I am relying on my colleagues, you, to to make sure that this area does not, I mean, this is a conclusion of 9 years, and I don't see a lot of change. I see some change, but as I mentioned to Karen earlier, I'm termed out, so I'm available to serve on boards now. So we can, in that way, we can offer that assistance. But in the meantime, I expect y'all to pick up the slack.
Tried, Madeline. I don't know if I was very eloquent, but I tried.
You did. You did. You were good. Yeah, and don't worry about eloquence. Let's just say it.
Right.
Great job. Great job. Thanks, guys.
So our next
Is Mika
folks-
on the board?
I'm a little bit weird. It's Mika, but it's Mika. I don't know what's going on, but I think Medicine Horse is next on my list.
Uh-huh.
I didn't know she was on the board of Medicine Horse.
I don't know. I was just,
So I'm gonna invite Mika in. Karen, I know Mika. Maybe some of you all know Mika. She works for the county. She's, but yeah. So gonna invite her in and see who else joins.
Hello,
Hello.
how are you all?
Hi.
Good. Okay.
we were trying to figure out where Mika Delgado came from.
Yeah, so I work with Mika Delgado at the Boulder County Healthy Youth Alliance, and she's the one that purchased our Zoom Pro membership. So every time I log on,
You're
like-
Mika.
and
I was like,
everyone
wait.
knows Mika, so I'm like, hold on, it's not Mika. Let me change this as quickly as I can.
All right. Well, Mackenzie, I'm going to give you a quick rundown of how this is going to go. This is our Housing and Human Services Advisory Board hearings for agencies applying for funding. You will have 15 minutes, primarily of question and answer from the board. Caitlin is our board chair, and she will be leading that conversation. Karen Roney, our community service director, will be our timer, and she will buzz us in and buzz us out and let us know when we are out of time. Okay?
Okay, that sounds great. And quick disclaimer, the executive director for Medicine Horse was supposed to be here this evening, and she had a family emergency. Her father actually went into the hospital. So I am a contracted grant writer. So I will do my absolute best to answer the questions, but we will be missing her perspective tonight, unfortunately.
Okay. All right.
All right, so I've just now started the timer.
And do we have any questions from the board to kick us off? Deanna.
So I'm just wondering if you could maybe describe, I was going to wait to ask this sort of rookie question, but I'm wondering if you could describe how your EAP program is different from maybe some other EAP programs in Boulder County, if there are really. You said there were not very many other ones, but I was just wondering if you could talk about the differences perhaps.
Yeah, absolutely. So there aren't really very many EAP programs in Boulder County, and the distinction with Medicine Horse would be the very laser focused services around mental health, and specifically for this request around youth mental health. So there are some equine assisted therapy programs that do things like coaching, like professional coaching, or host like what's the word I'm looking for, like employee trainings and things like that, team building, using the animal as kind of a centering point for that. And then also some more like physical health types of things. So I would say that Medicine Horse is unique in that focus specifically on mental health, and Medicine Horse does only use licensed master's level clinicians to run all of the groups. So I think that also is a distinction. And also just the focus on really individualized support. We offer very small group numbers. So some feedback that we've gotten in the past is that the reach is very small, but with that small reach, I think the impact that we're able to have is really large. So by keeping only 6 to 8 people in a group, that therapist is able to really develop rapport, offer some individualized support. Yeah, so I would say those are the main factors that really differentiate Medicine Horse.
Other questions from the board? Eliberto.
So I just had a quick question, Mackenzie. I'm not sure if you can answer this or really your executive director. But when I was reading your partner list for your program, I mean, I love the YWCA, love Intercambio, used to work at Intercambio. But I was wondering, just since this is a youth-focused program that you're applying for, if you could talk a little bit more, because I didn't see any. I mean, the YWCA, of course, is a great place in a lot of youth, but they're also not exclusively Boulder, but primarily Boulder because of where they are. And so I guess the question I had was, what other partners do you have in Longmont, or are you planning to develop to really provide that outreach in Longmont?
Yeah, if there's any way I can speak to that question. Natalie is going to text me a list of the Longmont specific collaborations that are happening right now. So if there's any way I could follow up with that list, but I will say that we've really had a focus on working with more diverse populations this year. So we collaborate with Out Boulder. I think a lot of their young people also come from Longmont, and then the Thorn Nature Center, where we recruit for a lot of our Latinx population. But I do think that we are establishing, so a lot of what Medicine Horse has done this year, we've really been able to keep programming going throughout COVID, and we've seen such a need for this service that we're really expanding moving forward. And part of that expansion is kind of bringing more partners into the fold. So I don't know if that's possible, if I could maybe send that list over once I talk a little bit more to Natalie about that.
Yeah, that's fine. I mean, yeah, you can send it over.
Okay, thank you. I'm sorry about that. I'll maybe send her a quick text and see if she responds in time.
Deanna, I saw a hand.
I know I already asked a question, but I'm just going to toss out a plug too to say, in working with youth, I'm a foster parent, and a lot of the kids that have been through our house have had trauma assessments where equine therapy was one of the suggested treatments. So I think in terms of reaching a really needy population for some of your services, that I'll just toss out there as a plug that you should consider reaching out to some people in the foster county, in the foster program in the county, to maybe get some youth routed your direction through that. I think it would be amazing. So that's it.
Yeah, that's a great idea, Deanna. And just real quick, my mom, I grew up doing foster care, not myself, but my mom did. So I always had one foster sister. We also had horses. And so I saw really for myself the power of the horse and working with young people who are in the foster system and just getting that real connection and kind of the stability of a horse. So I really appreciate that. Thank you.
Other questions from the board? I have one, Mackenzie, and I'm curious what the programs look like right now in terms of COVID precautions and sort of how that has impacted the programs you've been able to offer.
Yeah, so there was a time during COVID where everything was completely online. So what happened there is we really just did offer like individual and group therapy online. But since COVID, we follow all CDC guidelines and are very strict about social distancing and masking. We've actually made some modifications to White Dog Farms, where Medicine Horse takes place, to add some like kind of shade shelters that allow us to really space out even further, and just really practicing you know, hand washing. We have various like stations throughout the barn where people can get access to like those dispensers of Purell, and really just kind of underscoring that in any sort of orientation that young people would get as they sign up for the program.
Great, thanks. Karen Roney.
Thanks. So it looks like that you are planning to serve 8 Longmont residents. Is that correct?
Yes, that is correct. With this request.
So the so that's not a lot of residents, and that's not, you know, a lot of people served for, and I remember you're asking for around $10,000, maybe a little bit less than that. So so what would be, I know you had mentioned earlier in this conversation that you go small but deep. So I'm just trying to understand, you know, how this would be, what you would say that this would be a good investment for the Longmont dollars, given it's a pretty small number of people that would benefit.
Yeah, absolutely. So I'd say there are a couple things to answer that question. One is that this year we are looking to hire a youth coordinator. So one of the limitations for being able to reach more people has been just around capacity for coordinating programs. As you can imagine, scheduling and making changes due to weather and getting therapists matched with groups. There's lots of things that go into even just hosting one program. So part of the request would be to hire a youth coordinator. And then also, I think the amount of money that it costs for, like, let's say 2 hours of therapy, even group therapy within Boulder County, is quite high, probably anywhere from $175 to $200 an hour. And when you envision that we are having between 6 to 8 touch points with young people, it's actually a lot less expensive to offer this equine assisted therapy than it would be to offer a traditional therapy for about the same amount of time. And I don't think my brain can think quite that quickly for doing math, but let's just say $100 an hour for 8 people times 8 sessions. So that's quite a big chunk if anybody has a calculator. And then there are just lots of unforeseen costs that, not unforeseen, I'm sorry, additional costs that come with doing the equine assisted therapy. So just the vet bills, taking care of the horse's shoes, and they have to get vet checks. The farrier comes out often, the space that it takes to care for the horses, the staff involved in caring for the horses. So equine assisted psychotherapy in itself is just kind of an expensive service. But I think that the real beauty of this request is that it expands that service that has been shown to be so effective to a group that traditionally might not be able to partake in those services because of the cost barriers. And I would say that I think there's a section in the proposal that lists some of the randomized controlled trials that have found significant and lasting results of equine assisted psychotherapy. So while it is a large upfront investment, I think that over time, the sustained outcomes that young people who do participate experience kind of counter the bigger upfront investment.
So I noticed that there's very little diversity on the board and staff. So can you talk about plans for increasing that and having a more inclusive board and staff?
Yeah, I would say that is a real limitation of Medicine Horses board. And I do know that we are taking lots of steps to, at least within the organization, increase diversity training. We partnered with Boulder to offer 2 trainings throughout the course of this year for all staff and leadership related to diversity and equity. And I know Natalie has been in talks with the Denver Active 2030s Foundation, and they are an organization that kind of assists nonprofits in doing things like developing the board, developing corporate fundraising strategies. So we're partnering with them to figure out some unique and creative ideas for recruiting for the board. But I would agree that is a real limitation. And I do know that work is being done to increase diversity. I would highlight that while there's only 2 staff members, one of our staff members does identify as Asian Pacific Islander. So we have kind of a 50-50 diversity within staff. And also a lot of the therapists are contracted, so they're not reflected in the board and staff. They're all contract employees, but Medicine Horse does an excellent job of making sure that the people who are interacting with clients are reflective of the clients that they serve.
Thanks. Other questions from the board? Okay. Karen, go ahead, Karen.
Well, so if there's time, so, you know, how would you define equine assisted psychotherapy? So how do you compare that? So you have a group, you have a therapist, there's a horse, you know, so tell me how this all works together. We probably are more familiar with typical therapeutic groups, but so tell us how this works.
Yeah, so I would say the first thing about equine assisted psychotherapy is traditionally engagement in therapy is a big problem with young people. And the first thing is that young people generally are drawn to an experience in nature, an experience with an animal. So we really see strong retention from start to finish in our programs. And having that time to be able to interface with young people, I think really increases the efficacy. So the way that it works is there are usually 1 or 2 therapists and then a horse handler that assist with a group of 6 to 8 young people. And the animal kind of serves as like a way to diffuse some of the tension and some of the anxieties around the things that would come up in therapy. And so there are a lot of parallels made between like, if I can think of an example on my toes here, like in order for a horse to feel comfortable in its environment, a horse needs to have an awareness of all the things going around it, and then kind of explain how that would work for the horse, and then translate that into how that would work for a young person. So it kind of serves as like a non-emotionally charged way to talk about things that are difficult to talk about.
So unless anyone else knows the answer to this, I'm just curious. So in this case, are the young people, are they helping to care for the horse, walking the horse, riding the horse while they're having this conversation?
Yeah, so they do things like they would be grooming the horse, like you said, leading the horse, and kind of building the self-confidence and the self-efficacy that it takes to kind of take command of this really big animal that can be scary. And that builds a ton of confidence, and just learning that I'm able to have control in a situation, because a lot of young people that we see live in a lot of chaos and aren't able to really feel in a very tangible way that this is something that I can direct, and that I can regulate my emotion and regulate my mood to be able to guide this very large animal. So there is like a prescribed kind of ways that you interact with the horse and specific activities that are, I know Natalie is certified in one of those, and there are different methods of equine assisted psychotherapy, but that's kind of the gist of it.
Got it.
And I can get you definitely more information
No,
on
that's very helpful. I appreciate that. Since we had time, I thought I would ask. So our timer did go off. So we have concluded our time together, I believe. Caitlin?
That is correct. Thank you so much for your time tonight, Mackenzie. And I hope that everything is okay with Natalie and her family. And, if there's things that it sounded like that you were going to get us a list of partnerships in Longmont. So we'd love that follow up. And I think Ellie, you can coordinate with Ellie Berto for that, but hope everything is okay there, and really appreciate you being here and filling in on your toes for Natalie.
Yes, thank you so much. I appreciate it. You all have a great night. It sounds like you have a large list of partners to get through tonight. So good luck with that.
Thank you.
Thanks. Bye-bye.
Bye-bye.
All right, and the next group is mental health partners. And they are in the lobby, in the waiting room. I'm gonna let them in. All right, hello everyone. Feels like everybody's getting on board here. So this is our Housing and Human Services Advisory Board hearings for agencies applying for human services funding. Just give you a quick rundown of how it's going to go down. You will have 15 minutes of primarily question and answer. Caitlin Abbott is our chair, and she will lead the process. Karen Roney is our timekeeper, and she will buzz us in and buzz us out. And so I will turn it over to Caitlin, and we'll go ahead and get started.
Hi, welcome everyone. Thanks for being here tonight. We're going to jump right into Q&A. And so if there's anyone on the board who has a question, we'll start there. Graham.
Hi, Jennifer, Katie, and Kate. Thanks for coming tonight. My question is, have you hired a VP of Diversity and Inclusion yet? And when you do, what exactly will this person be doing?
Great, thanks, Graham. Yes, we've hired that position. She actually started in our new employee orientation this week. Our goal, as we were developing what this position would be, we know that it's a cross organization task at hand in terms of our diversity, equity, inclusion work and our journey. And this individual is going to be leading that work. So we had started, we've been doing some work for years. And in 2020, we started working with the Equity Project, and Dr. Donita helped with our senior leadership team. And then we did several caucuses with our staff. From that, we have an assessment and a framework and have some primary goals. And so Sarah D. Anderson is our VP, and she's going to be utilizing some of that information that we gleaned from the caucuses and from that work with Dr. Juanita to then help support. So really, it's going to be looking at policies, hiring practices, where we have both an internal and external goal, so also just service delivery, and then, internal training, education, but then also work with external partners and community members.
Great, thank you.
You bet.
Other questions from the board? Deanna?
So can I just ask a follow? I don't need your permission. I'm just going to ask a follow-up question to Grant's question. Is that VP of Diversity and Inclusion going to be working on board diversification as well? Is that one of their tasks?
Yeah, so we've done some initial work with our board, and I just spoke with her this week around that. I think we're determining whether she will actually do the work or whether it would be best served by someone outside of the organization, actually. So I think that's something that she's going to weigh in on, and we're going to talk about. We've definitely discussed that on the board and started some of that process. And so we should know that within the next few weeks, what that looks like. But yes, board diversification is absolutely a part of our work.
Other questions from staff or the board? Deanna?
Not to monopolize time, but I had a second question about your application. I noted that there's a budget shortfall of $227,000 this year, which you had indicated was due to changes in Medicaid eligibility and also some issues regarding COVID. With regard to the changes in Medicaid eligibility causing a budget shortfall, do you have a long-term plan for that? Because I'm guessing that the eligibility changes are at least in place for a while, and that has to be attacked somehow. So can you maybe describe that, your efforts on that a little bit?
Yeah, you bet. A big piece of what we're looking at is our revenue diversification overall. And one piece of that is we moved to a new system this year, and Kate, feel free to jump in and talk about this more if you want to. And part of that is looking at potential, not leaving anything on the table. So I think efficiencies and effectiveness in billing practices, collections, how we're, billing in terms of making sure we have the right provider providing the right service. Therefore, we are able to collect those dollars. So part of it is making sure that we're more efficient and effective. Some of the new system and platform allows us to look at how we're drawing down on grants also. I think a piece of what we've been working on, and COVID definitely affected this, in terms of the work, is also just working with members around eligibility and engagement, and how to make sure that we are accessing and people are getting enrolled in services that they deserve and that we can serve. So that's another piece of it. I think also, and Kate, I don't know, is there anything else you'd want to add on the ERP implementation?
No, we're looking at the credentialing and making sure that we are billing efficiently. And we're working with our contracts to make sure that we're not leaving that money on the table. And with the workforce shortages, which we'll get to, I'm sure, we are looking at creative ways to be able to serve our clients. So that's all I had to add.
And the only other thing I would add, Deanna, is that some of that, yes, there's COVID, I think Medicaid uncertainty, knowing that in March, some of that will start decreasing again. And we went in with knowing that we were going to be at a deficit budget, planfully around, we were still waiting to hear. And some of that is really because of what we're planning for one-time costs also. So for example, we're investing in a digital bridge to health. And so looking at how we can support, digital access, engagement with our clients. And so some of the cost that is in that deficit are these one-time costs. So it's not ongoing. And that was planful. And I think also planful, we were waiting to hear back on whether we would be forgiven for our PPP loan. And knowing that if we were, that would then cover that cost. And so that we did receive word last week that that was forgiven. And so that will shift how that end budget looks.
And Jen, I just wanted to add, a lot of the positions we added were revenue generating. And so with that one-time cost, we're investing in staff that's going to create revenue as we move on.
Eliberto, I see your digital.
Just a couple of one continuing on that budget, but then just really quickly, is Deb Connolly, were you expecting her as well? Deb Connolly? Okay, she might be the next group. I will not let her in.
Oh, Eliberto, you're saying, are we from MHP? No,
Yes.
We were not. Nope.
Okay, then she might be from the next group.
Okay.
No worries. All right, so then my follow-up question was, what I found interesting was I saw that 227,000 agency shortfall. I said, okay. But then I saw in the program budget an over $1 million shortfall. And I'd love to know, I read the narrative and I think I get it, but I'd love to get some clarity from you on, what the discrepancy there, or I'm assuming it's some sort of accounting thing, but yeah.
No, it's a great question. So yeah, I think really our behavioral health home, which I know that you read, is really around population health management and whole health. And a lot of, in order to do that in the model that we have developed in terms of outcomes, so outcomes, which eventually lead to savings, right? A lot of the services that are offered within our behavioral health home model are not necessarily reimbursable. And so that's where some of that shortfall comes. So we invest in it because we believe in that programming and that model, the multidisciplinary teams where we have care, coordination. We really look at assessment and getting people to the right level of intervention, being able to move people within and out of different levels quickly based on reassessment. So, knowing that there's other programming that can help support, but also, it's a lot of those services aren't fully funded. Sarah Reed, I don't know if there's more you'd want to add to that.
That's exactly the answer I would give, how I would describe it. And really, so that, like you see, the shortfall on the program budget is so much larger because of other programs throughout the agency that are more revenue generating can cover a little bit of that loss along with grant funding.
Karen Roney, I see your hand raised.
My hand is raised. Thank you, Caitlin. So I'll ask the question because it was on my list. So what is MHP doing about the provider shortfall?
It's a great question, Karen. And please, everyone, feel free to jump into. So, I think several things. We looked at salary. A big piece has been, we do market surveys. We're trying to get people to midpoint of market. Not everyone is. This past year, we were able to invest in staff to do that. So I think a big piece is retention of our current staff. We have amazing staff and trying to retain. And so different retention efforts were around looking at those salary bases. I think really investing in, we have a tuition reimbursement program. We're really looking at our training program. really looking at, internship programming. So really, how can we help invest in support and, the engagement of our employees? I think a big piece of that is going to be flexibility. We are looking at, a flexible model of service delivery, which I know many people have after, entering into COVID and needing to move to that pretty rapidly. We've learned from our clients that certainly some want to be in person full time. Certainly some want a hybrid model, and some want telehealth, and that's a primary mode for them. That's the same with our staff. And so really trying to address and support flexibility with our staff in that model also to help with that. And so, one of our strategic goals is really around employee experience and what we can do to retain. In regards to, I think, recruitment, we have a fantastic recruitment. I think a lot of that is looking at different places in terms of recruitment, different opportunities that we haven't looked at before. So we're just trying to get super creative. It is a challenge. And, I know, Karen, you and I have talked about it, but I think recently the 17 community mental health centers across the state had a survey, and we put together the data, and there's 1,008 positions that are open across the 17 community mental health centers currently. And that was actually 2 weeks ago. So, but it's a challenge. And I think one thing, we want to point out is that our overall turnover rate at MHP has actually gone down the past 3 years. And so part of the vacancies we have are around program expansion. So we've been expanding into our intensive outpatient for substance use, intensive outpatient for anxiety, mountain community expansion. So there's more expansion we're doing. And what we're hitting up against is we know there's the need, and we're trying to provide that access. And and now it's managing the hiring. So we definitely have all hands on deck on that. And it's going to be a challenge.
So, wow. 1,000 positions. That's mind-boggling. So, all right. So what's the message around come to work for MHP over the other 6, mental health centers serving the metro area? So what's your message around around coming to work for MHP?
Does anyone else want to answer that?
Well, I'll jump in really quick. I think it's really the mission and the community of what we serve and the passion that we have for our employees. And, at this juncture, and we're hearing this at other community mental health centers, it's really getting people that are mission driven and really believe in the work that we're doing. And we need to honor the people that are here, Karen, the people that have been here through all the challenges and tribulations that we've been through. They're amazing. And that word of mouth and that value that they bring is so important. And so I think really the message is really the community of Boulder and Broomfield and what we do. And we're really unique. And I know every community says this, but we're really unique in what we do and who we serve and the population we serve. And so the good news is, someone said this today in a meeting, like it's thawing out in the hiring. It's like we're starting to see that turnover and people are coming. And it's people that really believe in our mission. You're on mute.
Oh, Jen, you're muted.
Yeah.
Okay. I'll make mine really fast. So the only thing I would add is the new and creative things we're doing should, I hope, be a draw for people. And that's partly because of my role as grant writer and program evaluator. I get to touch a lot of the new programming and new strategies that we try to implement. But things like our community health worker program, our intensive outpatient programs, even the digital bridge to health that Jen is talking about, there's so many pockets of things we're trying to do that we need creative minds to make it happen. And I think there are a lot of, especially young people coming out of school, and hopefully there's a education pipeline we can tap into some more that we haven't really been able to in years past, to get some creative minds to help us do new things.
Yeah, and I think with that younger workforce, I mean, we do have an outstanding training program and opportunities for staff members, which ultimately is going to benefit the community, because then we can, you know, expand our service modalities and services.
So that was Beulah the buzzer that just went off. So that signifies 15 minutes has gone by. So Caitlin, I don't know if there's any other burning question anyone has, or how you want to wrap up.
I have a really quick follow-up question to some of the around staff is, you mentioned that you have low turnover. I'm curious what over the last 3 years, if someone has that offhand, or if you could let us know what that is.
Yeah, no, I think right now, but I want to be clear, Caitlin, it's not low. It's not where we want to be, but it's lower than it has been.
Okay.
So right now, I think we're at 22%. And our goal is to be at 18 or below. Healthcare is, you know, it varies. So we're within reach, but it's lower than it has been in the past 3 years.
Great. Thank you for that.
You bet.
All right. Thank you all for your time this evening. We really appreciate it, and hope you have a good rest of your night.
Thank you so much.
Thanks for having us. Take care, everybody.
Appreciate you.
So did we lose Madeline again?
I think so.
All right. So there are 6 people in the waiting room. So I'm going to let Shelly in and then ask her some questions. I'm not sure. So I know there was a shift. We had to change something, but my concern is, are folks thinking, are we doubled up? So I see Shelly, and then there's 5 more.
I'm looking at my list.
Well, the list only has Shelly on there.
Right, but I'm looking at the other people on the list for the subsequent agencies.
I don't know any of them.
And I don't see anybody on. So maybe start with Shelly and find out, did she bring 5 other people?
She bring the cavalry. All right. Hey, Shelly, can you hear us? Can you hear me? You should be able to unmute. There you go.
Thanks.
So before we get started, there are 5 people in the waiting room.
They're all us. They're all us.
So Charlotte,
yeah.
Deb, Jan, Maria, and Shauna are all you.
Us.
So what I would suggest, Shelly, this is Karen, is that, you know, we only have 15 minutes, so we probably don't want each person trying to answer the same question. So if you could help monitor that, that would be great.
I will, for sure.
All right, I'm going to go ahead and admit them.
Do you want me to help you let people in, Eliberto?
No, I can admit them all. I was just wanting to make sure that they were the right
Yeah, they were
people.
all.
All right. Actually,
We've got
somebody
a lot of
dropped
great
off.
new folks, so I wanted you to get a chance to meet them.
All right. So while everybody is getting on board, I'm going to go over how this is going to work. This is the Longmont Housing and Human Services Advisory Board hearings for funding. We have 15 minutes, which are primarily Q&A, so it's a short time. Caitlin is our board chair. She will be leading that. And Karen is our timekeeper, and she has been very strict lately. So she will keep us on task. If there is time at the end, we will let you share something, even though so far it's been pretty good questions from the board, so there has not been much time. But I'm gonna turn it over to Caitlin, and Karen will buzz us in and let us know when those 50 minutes start.
Great. Thanks, Eliberto. Hi, everyone. Thank you for being here this evening to answer questions. We'll kick it off and see if anyone from the board or staff have any questions to start off. Karen Phillips.
Hi, welcome everyone. I just had a question. I wonder, are there other ways you reach people other than the Hour Center?
Yeah. Hi, Karen. Thanks for having us. So we're all over Boulder County. So we, in Longmont, City of Longmont, we also partner with Hope. And we have done clinics at their location. We go to the soup kitchen Sunday lunches that are held in Boulder. We go to Sister Carmen's Community Center in Lafayette. So, and then our 2 locations in Longmont. And we've done vaccine clinics all over this year.
Eliberto.
So Shelley, when I was reading the applications, okay, so I read in the application somewhere that you have folks coming to you on a weekly basis, right? Because they know you're there. And I guess the question / concern I had is, what is the connection / maybe a warm handoff to a PCP, right? I mean, you guys do great work. You handle stuff, when you're where they are, but you're not a replacement for a PCP. I don't know, I'm not a medical expert, but I would think that you would want folks to have a primary care physician. So I guess that's my question is, does St. Benedict see itself as someone's PCP, or if not, what is the process of making that connection?
Yeah, good question. So no, we don't see ourselves as a primary care physician site, although we are recognized with this as a safety net clinic. I say what we do is provide gap care. So primarily with all the patients that we see weekly at the Hour Center, we are doing glucose checks to help them monitor their diabetes before their lunch. And we're doing blood pressure checks. Those are the number two top things we do at the Hour Center every week. So we supplement what primary care physicians do. So, but we keep records on every patient. So we know, do you have Medicaid? If so, who's your primary care provider? Is it Salute? Is it Hope Light? Are you going to UC Health? We'll have patients show up with a glucometer that their PCP prescribed for them, but they have no idea how to use it. And our nurse will sit down and spend 45 minutes, right, helping them figure that out. We do a lot of wound care. And then we also provide flu vaccines and COVID vaccines. So sometimes it's just easy. You don't have to have an appointment. We're there. We take care of things for them. So our referral process has been around since the inception of St. Benedict. So we have, we don't have an electronic health record currently, but we did just become part of the Unite Colorado referral program. But right now we still give the patients a handwritten referral. I fax that to the clinic, and then I email the clinic contact and follow up to make sure the patient got seen and their needs were taken care of. And we do that at all our sites, not just the Hour Center.
Can I just add a little bit to that? Jan and some of the other members of the Episcopal Church create a resource list for maybe people who are new to the area, who don't have a medical home yet, so that we can give them information on where to go to get that established. And having worked with the Coalition for the Homeless down in Denver for a few years, I think one of our other roles is helping to kind of establish that trust with the healthcare system again for people who stay away from it, who don't trust it. Seeing people like Shelley and our nurses volunteering every week kind of gets them saying, oh, maybe it's not so bad. Maybe I could establish a primary care.
And Charlotte, can you introduce yourself? I mean, most of the folks know me, but.
Sorry, I'm Charlotte Rochetti, and I've been with St. Benedict's for just over 2 years. I'm the current board president.
And a PharmD.
And a PharmD.
Other questions from staff or the board? Deanna.
So I noticed in your application, first of all, thank you for being here. second, I noticed in your application that you had talked about some funding sources from COVID money. I'm wondering if there's a plan for replacing those funding sources going forward post-pandemic. If those funds have been sort of worked into your budget now, how you're going to cover them down the road.
Yeah, good question, Deanna. Thank you. So we've never received human services funding, even though we've been a healthcare provider in Boulder County for 15 years. So you guys are hopefully going to fund us, and that would be a source for replacing those funds. We've also, besides just the vaccine funding, we've received established relationships with the Colorado Health Foundation, with Caring for Colorado, with those organizations. So we're talking about funding initiatives that wouldn't just pertain to vaccine funding. That has been what has helped us a lot this year.
Karen Roney.
Thank you, Caitlin. So you mentioned in your application that you are working with Aligned Influence on some strategic planning for the agency, as well as moving forward in DEI initiatives. So can you talk about the progress that you have made thus far?
Yeah, so we just started board development, but you know what, some of the feedback we got last year was not having a diverse board and a large board and being inclusive as an organization. And that was really good feedback. So where we are in the process with our board development is we have done the surveys of both past and present board members, as well as past and present executive team members, to collect data on how aligned are we and where are we misaligned. And then November 5th and 6th is our 2-day retreat with Aligned Influence that we're holding in Chautauqua. So we're all going to be together for 2 days and learn a lot. And we're excited because St. Benedict has never done board development before. So it's a great opportunity for us.
Thanks, Shelley. Other questions from the board?
So can I ask a follow-up? Sorry.
Yeah.
So, you know, so I'm just kind of curious, you know, the board has taken the survey and obviously your retreat's coming up. So what are the, overall, what are the areas that, you know, that the consultant has identified that you might want to focus on?
Yeah, absolutely. So, you know, we were founded as a church organization 15 years ago. So we've run a lot like a church where the executive team is closely monitored by the board. And so in our survey, you know, we found out that the executive performance was more aligned with the values of Aligned Influence than our board. So it was working on things like not micromanaging as a board, doing more strategic planning, getting out there and building relationships in the community as ambassadors, and learning really how to operate differently than a lot of church boards might operate. And those are Ken's words. Right. Of, you know, like you guys have gone past that. So now it's time to think past that. And, you know, not all of the board members on the call have gotten to see that. We're actually going to review all those results at our October board meeting. So that may be news to a few people that are part of the interview. But Charlotte, would you add anything else?
I think it highlighted what I think I already knew, is that as a board, we're a little too involved maybe in like minutia, and what we should be doing is thinking big picture and how can we engage stakeholders better, and let Shelley do all the wonderful things that she already does. But just to support her better and be more engaged in maybe the big picture. And here's, okay, we want to be able to do more vaccines, or we want to do more outreach clinics. How do we get involved with that? And then let Shelley make it actually happen with all the volunteers and the executive team. So yeah, I'm excited for it.
Great. So Caitlin, can I ask one more question? Unless I don't want to take a board spot. Anybody?
I have a question.
Okay, I'll go after you.
Okay. So one of the things I noticed in the application, you all were here last year and didn't get funded, but you noted that you had increased overall revenue by a fairly significant portion. And I'd love to hear how, sort of what some of the things are that you really think were impactful in that growth of your revenue.
Yeah, I'm gonna let Deb Connolly, who's our CPA, also answer this question, but I'll start out by just saying that I started in June of 2020. I'm a development person. I'm a Colorado native. I've lived here. So I know this sounds like I'm tooting my own horn, but I brought a lot of those relationships with me from the Colorado Health Foundation and Rose Community Foundation and others. And so I feel like, I was able to tell the story of St. Benedict's and get the word out and build on those relationships that we hadn't had previously. I'm only the third executive director that's ever served for St. Benedict's. So, I think that has played a major role. I think our mobile clinic and having our logo on it and being out there in the community, and working with Boulder County Health. So we work with Dr. Elizabeth Mendoza, who let me know, Shelley, you're the only ones in all of Boulder County doing homebound vaccines, and we would like to refer people to you. So they do. They just send them to us and we get out there and get them vaccinated. So, just getting the word out about our organization and building on that, I think has been great. I don't know, Deb, from a financial perspective, do you have anything to add to that? You're on mute.
There's that problem. I don't actually think, and correct me if I'm wrong, I don't necessarily think that was a financial question. And I think you answered it well, Shelley. I think the answer is having an executive director who just the passion that has been brought to that position. And I think, I'm assuming with Shelley's background is where she had a little bit more access to some of these other funding sources that she knew to go and tap. So again, I know it sounds like I'm tooting Shelley's horn, but I do think that was a big factor when I look, and I have only been around for a couple of months, but when I look at the differences in the funding sources from last year to this year, it's moving into that bigger picture. It's playing with the bigger, in the bigger sandbox. And I think Shelley just knew those places to tap. Would be, sort of a high overview of that. I hope that if that doesn't answer your question, please. No, that's helpful. Okay. Eliberto, I think Karen had one follow-up question. Did you want to do that, Karen, or?
Sure, and then Eliberto. So can you talk a little bit about how you are or have been working with, we have a vaccination team here in Longmont that has worked with public health, primarily how to address the vaccination equity issues throughout the year. So what has been the St. Benedict's interaction with our local vaccination team?
Yeah, so that comes from Boulder County Public Health is where I work with, and Elizabeth coordinates all of that for the whole county. And if not each month, sometimes even each week, when we were super busy, we were talking about who's doing what.
I guess I'll add to that is that the county also, worked with. So we've established some Longmont specific teams that some of our staff members are at the city of Longmont are coordinating. So I was kind of wondering about that in terms of Carmen Ramirez, a lot of the cultural brokers that are working with her to address vaccination equity issues.
Yeah. So I'm going to let Maria jump in and help me too a little bit, because both Maria and I have come together for St. Benedict's working on vaccine equity. And we got specific funding from the Governor's Together We Protect Fund to be a vaccine equity provider. And so, over 50% of all of the vaccines we have given have been to Hispanic population and Latinx in Longmont area, and working with the relationships that we, came together through that fund is how we would identify folks, working with Sister Carmen's Community Center. I mean, we were constantly doing outreach to help vaccine equity, to help people find us and to know we're there on the weekends. We're doing clinics at these locations. We have translators on site. We're ready to serve you. Maria, would you add something to that? And please introduce yourself.
I would really love to. I do apologize. One of my children is not feeling well, and I presented that beforehand and it woke up. So I deeply apologize. Philip, if you can just keep it down for 1 minute, I'll be with you in just a minute. So if you can hear me over that, I will add something really small. When I first came into this position, I was very junior as a vaccination coordinator for CDC, and the first thing I had to do was provide a presentation for the Colorado Center for the Blind, and I couldn't find any help. There were resources, and the first, hit that I got was basically Shelley. And so that was my first successful vaccine clinic, and we were vaccinating, people who were not able to access, anything. They couldn't register online because, the websites weren't accessible. They couldn't, find help navigating, the vaccine clinics themselves. And so, we got in touch through a mutual partner, and Shelley got in there, and we did first and second doses, and those kids who have otherwise not been able to find vaccinations were able to. And now I have a pretty strong relationship with CCD, which is key for somebody as junior as I am. So I was honored that Shelley asked me to join the board, and I just believe a great deal in what they're doing, and as a gay person, a person of color, to be included in this and to see others, I remember asking Shelley if we could have pride flags during one of them, and I remember, she was one of my members. So I will leave you with that.
I think we'll let you take care of your little one.
Yeah, now I'm gonna go to the back. But
Thank you,
I just
Maria.
wanted to. No worries. All right.
So so our time did end, and I know Alberto, you can be the last word. I
Yeah, no,
guess.
mine will be quick. Mine will be quick. I mean, so when we talked last year, after the process we talked about, and I want to congratulate you. Your financials were much easier to understand this year, and I know you're having these conversations with Aligned Influence. So, just a question: at what point do you all take the next step and actually have your own 501c3 and leave the Episcopal Church behind? Just maybe it's just a rhetorical question, not one to be answered tonight. But I figured I ask it.
Thank you, Alberto. City of Louisville gave us the same feedback. They have always funded us every year until 2 years ago, and then they said we're no longer funding religious organizations. So, I do think basically we are part of the Episcopal Church and we aren't. Legally, we are independent. We carry all of our own liability insurance, anything, related to our organization. If God forbid there should be malpractice, doesn't touch the Episcopal Church. It stops with St. Benedict's, right? But our tax status still puts us under that umbrella. So it's an interesting relationship, and I hope the board's going to talk about that more. We've definitely brought it up in the past. So when is the answer? That is a very good question, and thanks for asking it.
Great. And I think we are at time. Thank you all so much for your time this evening. I know 15 minutes is not a lot, but we really appreciate you spending some time with us.
Thanks for having us.
Thank you so much for your consideration.
Have a great night.
Have a good night.
All right. So we have the next group, which is pure asterisk. They are in the waiting room, and we're right on time. Wait for Soren to connect. All right. So you can unmute yourself, Soren, now. I'm just gonna do a quick rundown of how this is gonna go. So first of all, welcome. This is the Longmont Housing and Human Services Advisory Board. This is our funding hearings. We're gonna have 15 minutes of Q&A, primarily Q&A. If there is some time at the end, we'll let you share with us. Caitlin will be our facilitator. She's the board chair. Karen Roney, our director, is our timekeeper. She'll keep us on task and she'll let us know when we go out. I'll turn it over to Caitlin.
Hi, good evening and welcome. Thanks for spending some time with us this evening. We'll dive right in and see if anyone from the board or staff have questions to kick things off. Excuse me, Graham.
Thank you, Caitlin. Hey, Chris and Soren, thanks for joining us.
Hi there.
I noticed you do before and after surveys to solicit information about the program's effectiveness. Can you give an example, if there is one, of a time you made an adjustment to your program based on that information?
Let's see. I'm thinking that's pretty typical. I think in terms of the way we work, we're coming from largely like a contemplative background in terms of how we approach the work we do. So, we tend to work a little bit, not entirely just out of looking at like a traditional diagnosis. So a lot of things are very much, the approach is very collaborative in terms of what the actual program is and how it's delivered. So we're very responsive to the folks who are actually participating into, what the programs are that we're delivering, more engaged in a process and working with what works for the individual folks. I think from a clinical standpoint, Soren, you might have more insight into what that actually looks like clinically.
Yeah, I mean, I'm thinking about programs though, where, our queer conversation program, we took feedback from the group and had structured themes was a change that we made. Thinking about some of our therapy groups and shifting how we structure and meet the kind of the order of events during a program. So shifts like that. I think maybe Chris and I are having trouble coming up with specific examples because we're constantly shifting. So that's, seems like the best answer for the moment.
Okay, thank you. I have one last question for myself. Are there any other organizations that you look to that provide the telemental health that you collaborate with or look for, as a model that you aspire to or just share information with?
Let's see, I'm thinking in terms of collaboration, not as much through the telemental health. We were delivering telemental health prior to the pandemic. And actually this, this would be a first year of funding for City of Longmont, but this is, kind of an extension of a program we've been doing for the last 2 years in Boulder. So we fortunately had it underway before pandemic, but even prior to that, we were working, in the realm of doing online programs. Obviously in the last year, we've developed considerable strengths of what was originally just the one-on-one counseling therapy services, then all of our community programs obviously moved online. And that, we've had that continued evolution of, responding to the needs and answering how that works for folks, particularly, in the community portion now is, the kind of wanes we've seen around like Zoom fatigue and figuring out how to keep things alive and developing some hybrid practices as well. But outside of the online delivery, collaboration with other organizations like Out Boulder, some other mental health organizations, Whole Connection, and Umbrella Collective are groups that our leadership, as well. I'm sorry, one other organization, the
Anything of the center?
yes, and the
and
Rosina, Therapists of Color Collective, Collaborative.
Yep. Our organization, our clinical director goes to a meetup of the directors of a lot of those organizations. We do that once a month, and we get to talk with these other organizations that are similar in size and also, population served, and consult about certainly telemental health, but also kind of the ins and outs of lots of different ways that we're delivering our services and making sure that we're up to speed with, not just the trends, but also up to speed with being in compliance for insurance and all the different things that we have to pay attention to. It's nice to have other directors to speak with.
Thank you.
Your program narrative and budget request includes a target of 15 City of Longmont residents. And I was sort of comparing that to the total number of unduplicated clients that you have served in the 2020 fiscal year. I'm curious right now what, sort of for the past year, you've seen a marked increase in demand for services. How many folks are you providing this sort of like one-to-one program for already? And how much, I'm trying to get a sense of how much this would help you expand it.
Let's see, I think in terms of like the one-to-one, just like current like therapy clients in Longmont, is that okay? We're significantly more than 15 is what we have done this year. And let's see, Soren, do you have more insight into that of like a specific number?
We have probably 450 clients that we see every month from all of our locations. Probably 100 of those are Longmont clients.
Okay. Thanks. Eliberto.
So looking at your financials, I saw two things. One, it would be great if we get a balance sheet. We got a profit and loss, but we didn't get a balance sheet. So if you could follow up with that just to see where you are or where you were in 2020 is fine. And then
sure.
I saw a great increase in funding so it was nice of you to put in 29, the 2018, 2019, and 2020 year end numbers. And your two biggest growth areas were in your counseling revenue, but really it was your grants and donations. Of course, you had a fundraising event. Could you talk to that growth? I'd love to know, it significantly grew. What is it? Was it COVID funding? What was it that, where did that growth come from?
It was a combination of all of those things. I think our grant funding really kind of got off the ground initially with some COVID funding. And as well, we had a private donor who came in who basically the biggest investment for 2020 was we were able to expand from one employee initially. It was an initial investment to make the 4 directors all employees. Prior to that funding, Soren, our executive director, was the only full-time employee, and the other 3 directors, we were all part-time contractors. And so through that initial investment, then we have now grown to, we have onboarded, I think, an additional 5 employees. So most of that did come through private funding, and was specifically designed for staff infrastructure. And then, as well as you mentioned, the counseling revenue, and that as well, you know, a direct result of COVID as well, and just the increase in the demand for services.
Karen Roney, and then Deanna.
So I, hang on. Okay, need to make sure I wasn't on mute. So in some of the numbers, so I think Caitlin was trying to ask this in terms of service expansion, but there's some differences in the numbers that you have in terms of Longmont people that would be served. So I think I saw in one place in the application, it talked about 80. I think for this particular proposal, it was another number that I wrote down, like, I don't know, 15, something like that. So I guess maybe my question is the program for which you're funding, is it basically that you are requesting subsidy for, you know, for your fees for individuals who might not be able to afford the, you know, what your market rates are for service. So maybe can you talk a little bit about just what would the money that you're requesting from Longmont, what would it directly support in terms of your program?
Sure. Yeah, and that is definitely the intention and the design, is that it would be providing services to folks who otherwise wouldn't have the availability to pay for that. And so the numbers, there's somewhat variance. This program, again, I said, is you know, modeled on what we've done with Boulder for the last couple of years. And the initial approach with that was we were looking for more like short-term, like, you know, providing funding for a person to get in for like 4 to 6 appointments. And basically then kind of with the state of mental health where it is, of recognizing now that folks are needing a much more extensive delivery of services. So that is, you know, what the numbers are calculated on, is looking at the idea of providing more of like a 6 to 9 month availability, so that, you know, it's not of someone, you know, just getting in for a one-time, like trying to get through one specific problem, and looking at trying to do some more really in-depth work over a period of time.
Great. And then a follow-up is, you know, how do you all determine who would be eligible, or who has a hardship? How do you define hardship? Do you have a sliding scale, or just how would you define who would be the recipient of assistance?
I can answer that if you'd like, Maddie.
Sure.
Yeah, I would say that we offer a sliding scale. It goes from 0 to the full rate. We opted against having an application process, recognizing that adds further work to the person who is needing those services. And so we go by pretty much an honor system, and ask the client. So if they have insurance, then ask the client if they can afford their out-of-pocket rates. If they can, that's the rate that we use. Sometimes folks can't, and we subsidize that. A lot of the folks, though, that we're talking about aren't insured. And so we try to offer a combination of helping them to get connected so they can sign up for Medicaid, and then also in the meantime providing these pro bono or sliding scale services.
All right, great. Thank you.
Thanks so much. Other question, Deanna, I think you had a question.
Yeah, I was just curious how your clients find you. Do you market? Do you get referrals? Probably all of that, but maybe you could just describe that a little bit.
Sure. Or go ahead, Soren.
Yeah, short answer is that we have a lot of contacts with within the school systems, the university systems, mental health systems, and because we do educational trainings, so that we get a lot of referrals through those contacts. We do marketing as well. We have our website, Facebook, Instagram. A lot of people find us that way. And then also within the queer community, a lot happens word of mouth. So current clients refer their friends and family, and news spreads that way.
Great. Karen, I think I heard the buzzer going off.
You haven't yet, but hang on. In 17 seconds, you will hear Beulah.
Beulah the buzzer.
Beulah the buzzer. So if Soren and Chris want to add any comments, that would be great.
Yep.
She just went off, but you have a couple of minutes
Yeah.
if there's anything you want to add.
We've got like a minute or two if you want to add anything that you'd like us to hear.
Okay. Yeah, no, I think just we would really appreciate the, the additional support. We're definitely very rooted in Longmont. We do have an office location in Longmont that we still maintain, although we have not opened to in-person visits, just out of, going with the abundance of caution of keeping everything entirely virtually. But yeah, no, again, we appreciate your consideration, and we'll be in Longmont. We've been there for several years, and we plan to be around for a long time. Soren's a homeowner in Longmont, so we're definitely part of the community, and happy for to be considered for this.
Yeah, I would just add thanks for your consideration. Mental health and serving the queer community is near and dear to our hearts, and it's a pleasure to be able to sit before you and share the work that we're doing.
Great. Thank you both for your time this evening. We appreciate it.
Yep. Great. Thank you all. Appreciate it.
Bye.
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 All right, our last group is in the waiting room, and that is Safe Shelter. We had to switch, so they are in the waiting room. All right, I'm gonna let them in. Hello, Jackie and Jenny. I'm assuming that's Jackie under the Safe Shelter Zoom. Thank you for working it out so that you could be here tonight. I know you have an event coming up soon that we had to switch, and that's fine. Appreciate you working it out with Erica. So I'm just gonna go over how this is gonna work. We have 15 minutes. This is the Longmont Housing Human Services Advisory Board hearings for the funding. It'll be primarily question and answer. Caitlin, our board chair, will facilitate that part. Karen Roney, our director, will be timekeeping, and she's been good about doing that. So we appreciate your time tonight, and I'm going to go ahead and turn it over to Caitlin for the Q&A session.
Okay, thank you.
Hi, thank you for being here tonight. We'll dive right in and see if anyone on the board has a question to kick us off. Deanna.
Hi, thank you for being here. I was just curious if you have seen an increase in the need for services during COVID, since everybody's sort of stuck at home, how people are accessing your services, and if you've had to employ new strategies to get people to have access to you who may be trapped in with people who are stuck at home with them. So, and if those strategies have had additional expenses that you've had to incur.
Okay, thank you for the question. It has been quite a ride. And what happened initially when in March, when the stay-at-home order went in, our phones in essence went dead because the offenders were at home with the survivors. And it was pretty quiet for a long time. During that time, we had to change our situation at shelter. Health department requested or required us to have no more than one adult per room. And we have 6 emergency rooms and 2 rooms that are set up for extended stay. So we made extended stay our quarantine rooms, and then each of the other 6 rooms, 1 adult. If that meant there were 5 bed spaces in there and it was a single adult, that's what we needed to do. So we got through that way. And I just want to say for everybody, I know you all remember what a scary time it was, and stay at home. I mean, I remember going to Home Depot and not wanting to touch anything. I was wishing I could fly because I didn't want to be around people or touch anything, just the uncertainty. And yet we had people, our shelter people came into work every day and did what they needed to do day and night, all those shifts in order to take care of the people. So, and Jenny, jump in anytime to sort of help me out with this. So for a while, everything was very quiet. And then as they lifted those orders, the phones started ringing again. What happened was that we had people who had no access to food, who were hurting for their rent, who, you know, they weren't going to work. And for some people that was fine. You could work at home, not if you're a waitress, you know, not if you're a clerk somewhere. So we were handing out food to our public clients, and motel stays, because our shelter was so limited. If we had someone in imminent danger, and all of the shelters were in the same kind of a situation, we managed to get hotel stays for people. So our budget shows quite an uptick in cost, but our community really helped us out. I mean, if you look at how much individual donation went on over and above anything we've ever had in any year prior to that. The government also, you know, money just poured in to help us keep those folks housed who couldn't pay their rents, and get people into motels. And we're still doing that. I mean, we are still keeping our numbers, because it does this, right? The whole pandemic, 1 minute, it's take the masks off, go have a good time. And then it's, oops, no, everybody masks back on. So we've kind of ridden those waves. And right now we're in a limited number of people in the shelter, and helping people stay housed. So we're still doing the same kinds of things. We just did much more of it in the beginning. Am I forgetting anything, Jenny?
No, actually, I think you covered it all. I do want to just add to that. Part of the scary piece there at the beginning, I was working in the shelter at the time, and a lot more calls from victims who were whispering on the phone because their abuser was in the next room or upstairs or down or whatever. And so we had a lot more of trying to safety plan with people who couldn't get out in the immediate future. So yeah, scary time.
Yeah, lethality was also up.
As
numbers of
still,
numbers of cases skyrocketed, and the lethality of the cases was way worse than it was before. And that has continued, sadly, to be the case.
I have a question. One thing I noted was that you mentioned that a high percentage of the Latinx population that you serve, around 40% are monolingual Spanish speakers, and then your program budget includes some bilingual support advocates. Is that additional staff on top of the current staff you already have, or is that the current staff members that speak Spanish, that it would continue to help support them?
Right. We have not added staff. I mean, we did add a children's counselor because that position had been open for a while, but the bicultural bilingual advocates, and they are in our public office, have been with us for 5-7 years. So
would the Longmont funding continue to support them, or expanding that staff, that bilingual staff?
Well, we are right now looking for a bilingual advocate for shelter. So that money will help us with that.
Okay. Great, thank you. Other questions from board or staff?
I'm curious as to when you say you're recruiting, you're actively recruiting for bilingual, bicultural. Have you reached out to the NAACP? Because there are others that are bilingual that, stop it, that you could draw from. That could be a recruitment pool that is available to you. So my question is, have you reached out to them, and would that be a consideration?
It's definitely a consideration, and I did last year reach out. I also, last year, I believe you gave us a list, and it may have been the year before. I've kind of lost track of time, but you gave us a list of prominent African-American folks in the community, which I turned over to my board. We've had board turnover and new officers coming on. We have someone who is an expert, actually a PhD in board governance, and she is all about this. So we just went through strategic planning, and now we're going to be recruiting board members, and that list is going to become very active for us.
Okay, very well. Well, I am, as I mentioned prior to you coming on, this is my December will mark my term limit, and so I too am available.
Okay.
Feel free to contact me.
I will definitely. I may not, but a board president sure will. Or Nancy
well.
Herbert. Nancy Herbert is the person with all the experience in education. And what she said was, if you wanted her number, I could give you that, but I don't have it with me right now. But I will definitely.
Not a problem. Not a problem. I'm not. It doesn't end until December, but yeah, I'm just letting you know that I'm available. All righty.
Other questions from board or staff members? Eliberto?
So I think, Jackie, we've talked about it on other times, but I'm just wondering, what's the timeline right now for if, when you have someone that you are sheltering and then transitioning him into some type of either transitional or emergency housing, or, I mean, I think, best case scenario is getting him into a permanent situation, but what is that looking like? I'm just wondering with how we're doing with affordable housing in the community.
Well, and Jenny, you jump in on this one too, because you're closer to this than I am, but we are using a lot of the programs like HSP, the county program. We have an MOU with the Inn so that we have 2 units there that are kept for us. And then we can also get other people in. We're working with organizations in Denver. And we're also working really hard to keep people who are housed. I can't give you actually a timeline. I mean, when people come in to shelter, and that's where most of our housing for folks land, prior to hooking them up, so to speak, with any kind of housing program, we wait to sort of gauge where they are in their process, whether they're going to be successful. So that can be 2 weeks, it can be 6. A lot of times we have to wait longer. So our stays are being extended well beyond 6 weeks because we're trying to wait for those housing options to come open. But affordable housing, that's a relative term. And that's still, if you look at the salaries of our clients without the abuser, $5,000 to $10,000, the majority of them. So that doesn't allow you to get anything in Longmont without a lot of assistance. So programs like HSP in the county and the Inn that gives them 2 years, those are really, really helpful for people getting back on their feet. But there's not enough. You all know that. There's just never enough.
Karen Roney.
Thank you. So I am interested in learning more about your movers assessment.
Okay, Jenny, you want to talk about that one? She is way closer to the movers than I am. I can start out by saying it is an evaluation process, or more like, gosh, I can't remember the name given to some past.
Like the CFSA, the Colorado, the RC.
Yeah.
It's kind of a
Yeah.
self-sufficiency matrix type of thing.
Yes, thank you. That's what I was looking for, self-sufficiency matrix. It is very similar to that. And it has been presented to us, and it's being followed by the domestic violence program, which is part of DHS state. Jenny, can you talk a little bit more about the specifics of movers?
Yeah. So it is a lot like the self-sufficiency matrix, however, much shorter, which is very helpful. And so the purpose is to get a baseline from our clients. If they're coming into shelter within the first week or so that they're there. And then, so that assesses where they are in the moment regarding how they feel, where their safety is, how they feel comfortable finding resources, and moving forward in their personal journey safely. And so that kind of gives us a baseline to work with them. So the advocate sits down with them and goes through that. And then that also gives, it's actually a really cool tool. It gives the advocate some information on how to possibly work with the client in moving forward. And then they'll do the assessment again in maybe 2 weeks to see where they land then. And a lot of times what happens is they score lower because they have found out exactly where they do feel. You know, when they first come in, they might just be happy that they're out of their situation. And so they're scoring a little higher. But then after they settle down a little bit and realize where they are, they might score a little lower, but that also gives them and the advocate some things to work on. And then again, we do it hopefully in another 2 weeks or so. And hopefully at that point, their score goes up to where they're feeling safer, they're feeling more confident in finding resources. They have a sense of community around them, and they feel like they can move forward in some manner to become self-sufficient. So it's a great tool for client and advocate to work on together. And I know Jackie and I went to the training together right before COVID hit, of course. And we were super excited about starting it. It's been a little slow going with COVID because we weren't, especially at our outreach office, we weren't seeing people in person, and it's kind of hard to do on the phone. So we're getting there, but it's a really great tool that we're looking forward and using more often in the coming months.
Where it differs from the self-sufficiency matrix is that it has a really strong emphasis on safety. And that's the piece where they, they're not feeling unsafe because they're not feeling. Then in that next week, they start realizing more about the dynamics, more about coming a little bit clearer about what's been happening to them. And that's the dip. And as Jenny said, then it goes back up. Did that answer your question?
Yes, it did.
Okay.
And I have another question that I'm sure I asked you that last year, but I don't remember the answer. So do you do have operating reserves, but what do you have, or do you use those operating reserves for your capital replacement? Because you operate some buildings, they are well used, and so I'm just wondering how you manage your capital replacement needs for your facilities.
Is how we do. Happily, most of the time we can squeeze the money out of the regular budget, but we had to replace our ramp. So that was a $10,000 hit. And the house is now 14 years old. So everything's starting to just kind of sigh and wear out a little bit. So my guess is we will be dipping into that more. We haven't had to go deeply into it. And we can write grants. I mean, we write grants. There is a family foundation, the Beanie Collins Foundation, that helped us out with the ramp too. So they generously give us about $10,000 a year. So that really helps. And they like brick and mortar. The money to be spent on brick and mortar stuff. So.
Okay, the buzzer buzzed. So I don't know. There's another last question.
Seeing none. Thank you both for your time this evening. We appreciate it. And I hope you have a good rest of your evening.
Thank you.
Thank you.
I imagine you all are kind of tired yourselves by now. So, yeah, have a good evening. Thank you.
Thank you. Bye.
Bye.
And that is it for the evening.
That's night number one.
Night number one for our new folks. Yes, we got 3 or 4, and then we got a Saturday. I forget.
No, we have 3 nights and a Saturday. I think we have 5 altogether, 5 sessions.
Right. So if anybody has any issues, I mean, again, I apologize for what happened with it getting erased. I know some of you had worked already on it, so my apologies for that. It was a weird circumstance of events, just weird. But if anybody has any issues, let me know to score these. Kimberly.
Good question. I thought I saw that you said that they were saved, but is that not right? Do we have to go back and redo them?
Well, no, I have your scores in a spreadsheet that I can send you the scores from a spreadsheet. It's not online. So
okay.
I can do that.
As long as they've been saved, I won't go back and redo them.
Well, yeah, I can do yours from you did a couple,
Yeah,
right?
so bottom line is you don't have to go back and redo your scores.
Excellent.
Correct.
Okay.
I can get to them.
That would be heartbreaking.
Yeah. Well, okay, so the caveat is if you hit, I think only if you hit submit or say, I don't remember if I'll go back and check. I'll go back and check to make sure. And I'll follow up with you, Kimberly.
Thank you.
All right. Unless anyone's dying to stay on and chat at 8:37.
That's good.
We'd love to, but we would also it'd be fabulous to say nighty night.
Bye. Thank you.
Good night, folks.
All right. Bye.
Bye.